Steve. But doctor, that's a great segue because I think we're in now we're just about to enter, but I think we're in a new stage, which is really exciting, which is sort of personalized treatment for cancer patients, both in terms of recognizing that not only are there hundreds of diseases, but in some ways everybody's disease is a little bit unique. And you can treat an individual's disease as opposed to just a type of cancer.
I agree, and now that we've learned about taking an individual disease, we're now talking about going to an individual patient. And so as we've been profiling the tumor cells themselves, we've been finding very specific genetic mutations that may occur in some patients with the disease but not others, and we now have drugs that will target that. And I can give you a good story in melanoma. We had one of these targets and we developed a drug to it. We tested it and it didn't look like it did much good. But we never tested the patient to see if they had that mutation. And when this was sort of redone, where we were able to test for the mutation and give them the drug, the response rate was 70%, at
Wow.
least in the very first phase 1 study. So there's a lot of excitement in the melanoma community about these targeted therapies. And I think this has now been shown to be the same case in lung cancer and in kidney cancer, and we hope in many other cancers.
And it's really incredible because it's sort of multi-front. We're working on therapies and treatments, but also the understanding of the microbiology of cancer has had a significant role in really the last 5, 6, 7 years.
Yes.
And this is a little bit of a different question, but you're having gone through, seen so many patients with melanoma and skin cancer and other cancers. If you could tell people generally a word or two of advice. Somebody gets diagnosed with cancer, what should they do?
I think the most important thing if you're diagnosed with cancer is to get information. So it's really important to talk to your doctor and ask him about his experience with this particular cancer. If he's not experienced, does he know somebody who is? To call a reputable source of information like the National Cancer Institute, the American Cancer Society, or a local cancer center and get as much information as possible.
Such as Chicago Blood Cancer Foundation for those of you with lymphoma, leukemia, or myeloma.
Correct.
And Dennis, you're here, and here's your opportunity to talk to Dr. Kaufman.
Hi, Dr. Kaufman.
Hi.
I want to know how important do you think a doctor's bedside manner is? To my way of thinking, if someone has already received a diagnosis of cancer, I think there's a lot to be said for just the fact that a good percentage of those people just might not do as well as they could in a hospital environment. However, if there was somebody willing to make a house call to them, it might make all the difference in the world to them, because the stress involved for some people, just knowing that they have cancer in general, that compounds other issues in their lives. But if there are oral medications, as you stated, available to them, maybe just having someone reassuring, like I say, with a good bedside manner, come to their home and just spend a little time with them, kind of a more holistic approach.
Dennis, that's a terrific question. Doctor, what do you think?
I think just as we're sort of looking at the patient's individual tumor to learn how to treat them, I think it's a really good point that we need to look at the individual patient. And I just couldn't agree more that the bedside manner and how we approach patients makes such a big difference. And again, I think one of my goals at Rush is to really bring together not just the expert physicians, but also the psychosocial oncologists, the social workers, other people that can really help make the experience so much better. I don't think there's anything more anxiety provoking than hearing that you have cancer. And certainly, patients go through an enormous amount of stress, particularly early on after hearing that, and finding somebody who can, help you fight the battle and help understand your wishes and how best to approach you is something that is so important, and I think is part of what we would call kind of a management plan for the patient. And some patients will do good with home visits, and it's something that we used to do many years ago. I think with healthcare reform, it becomes increasingly difficult to always do that. But we certainly can tailor-make programs and really try to address all of the patient's needs. And I think, as was mentioned in the beginning, there's 14 million Americans walking around now who've been cured of cancer. And this has led to a new, really subspecialty called cancer survivorship, and understanding that these individuals have special needs. If you get a stomach ache and you've been through cancer, probably is nothing but a little gastritis, but the level of anxiety is enormous with that. And so understanding how to approach these patients and how to get people managed for all of their needs is something that we're beginning to look at in a serious way.
And Dennis, we always say, if it comes down to getting the best technical doctor, the most expert doctor, or someone who has a great bedside manner, take the best technician every day. But you don't have to make that choice, because when you see all the fine doctors that we've had on, Dr. Kaufman, Dr. Gautier, Dr. Gordon so far, Dr. Gregory, and others coming up, when you're in Chicago, you don't have to make that choice. You can get the whole thing. Somebody who's the best of the best in their field technically, somebody who has both the research and clinical components of the practice, and somebody who cares about the patient. So, Doctor, in the next minute or two, why don't I turn the floor over to you and talk about just in general the importance of cancer research and how all of us as patients and survivors, as well as doctors, can work together for all of our good.
Yeah, so it's definitely, I see this as a team sport. I think that this has to be an alliance of the physician community, patient and advocacy groups, and the government. The importance is that as we've been putting more money into cancer research over the last 10 years, the effects have been dramatic. We've had 2/3 of cancers are now curable. We are controlling cancers more and more. So if you look in my disease, melanoma, which is one of the few that really hasn't gotten a whole lot better, every year for the past 10 years, we've seen a slight improvement in the survival for patients. And I think that while there's many reasons for that, a big part of it has been the impact of research, because we've had more drugs to get to patients. And what we're now learning is that even if a very small number of patients benefit from a particular drug, we now have the tools to really understand how to find those patients and get them the right treatment. And I think the next 10 years are going to be amazing in cancer research. I think we're really poised to have an enormous impact. Like I said, industry is very interested now in cancer, which I think is also new. And I think we're just entering a brand new era. And the focus now on clinical research, not on mouse research and not on cell research, but really getting things into patients, it could bring immediate impact. So I think it's just the most important thing that we can do. And, I think groups like the Chicago Blood Cancer Organization and others like this are really very visionary in their thinking and are really going to do an enormous amount of good, both for the individual patient and everybody, so that cancer one day will be completely controllable.
Well, Dr. Kaufman, we thank you not only for coming on Battling and Beating Cancer, but for the terrific work that you and your colleagues at Rush are doing. And we look forward to speaking with you in the future. Well, and this is what we're talking about, ladies and gentlemen. We all can make a difference, and there's something that we can help not only ourselves do, but our neighbors and those who will get cancer. We have to do the cancer research. And welcome back to the beautiful Charlene McMahon. Hopefully I'm scoring points tonight, ladies and gentlemen.
He's not scoring any points, believe me. He's just putting on a show here. I want to thank Dr. Kaufman for coming today and just wonderful information, and I hope it's really good information for all your viewers. I also want to thank our producers, because without them we couldn't be here, and that's Dorothy and Christy. And I want to have you join us, and thank you for joining us on Battling and Beating Cancer. You can reach us again at Battling and Beating Cancer Chicago Blood Cancer Foundation, and our phone number is 888-792-9992, and that's www.chicagobloodcancer.org. And next week's show, we're going to have a really, one of our favorites, Dr. Henry Fung, Director of the Section of Stem Cell Transplantation at Rush University Medical Center, and we will be talking about stem cell transplants, which is important for blood cancer and other forms of cancer as well. So please join us next week at 7:30 p.m. on CAN TV 21 with Battling and Beating Cancer. And I just wanted to say what a great show this was, Scott. I give you a couple minutes to talk to my husband here on the show.
Well, and that's because of you and Dr. Kaufman. But, I'm not John F. Kennedy, and everybody knows that.
We know that.
But I want to.
He's not here. So.
I want to try and turn a phrase, which is we talk a lot about what we can do to help you folks with cancer. And I think everybody out there should also ask the question of what can I do to help other folks who are battling cancer, because there's something that everybody can do,
Yeah.
whether it's taking time to talk to somebody, whether it's helping them by doing some chores for them, whether it's raising money for research. There's something that all of us can do to help somebody and to help all of us with cancer.
Right, and again, if people don't have the support system, like say a husband, wife, a brother, sister, they need to reach out to their communities, go to churches, go to hospitals, even hospitals nowadays, like Dr. Kaufman was saying, and they have more, and Dr. Gutierrez was saying that too. There's support, there's emotional support for the cancer patient and the family, because a caregiver, as I have written before, a caregiver needs help too, because they're going through a stressful time. They're trying to, keep everything going for the cancer patient. So I want to just leave this show by saying thank you, and we're very happy to have this show here so we can reach out to everybody and say, we are here for you at Chicago Blood Cancer Foundation. Please contact us.
And thank you, everybody, for joining us. And until next week, we'll see you on Battling and Beating Cancer here on CAN TV 21. Good night.